Hello, everyone. Thank you for joining the Center for Victim Research's interdisciplinary panel on protecting victims in research. My name is Janine Zweig, and I'm a senior research fellow working with CVR to help build a community of collaboration between victim researchers and service providers. In 2018, CVR funded 9 researcher and practitioner fellowship projects, and today we'll be hearing from 3 of these fellows, including Sarah Feldman, Gina Mastro-Cinque, and Carol Berger. In this short 30 minutes that we have together, I'm going to ask each panelist to briefly introduce themselves, and then I'll ask one question of each fellow. So Sarah, could you please introduce yourself briefly?
I hope you can hear me. So I work at the University of Iowa in the Office of the Sexual Misconduct Response Coordinator. OSMRC is what we call ourselves, and our office receives reports of sexual misconduct, dating, domestic violence, or stalking involving any members of or visitors to the University of Iowa community. Part of my responsibility involves reaching out to individuals who have reportedly been harmed, and really that's to explain options both through the university as well as through law enforcement. Provide linkage with support resources like advocates and counseling, and also facilitating accommodations that might be needed to address safety concerns or just due to the impact of trauma. I've been with OSMRC for about 8 years.
Thank you, Sarah. Gina, would you please briefly introduce yourself?
Hi, my name is Gina Mastro-Cinque. I am a faculty member in the Department of Law and Justice Studies at Rowan University. The project that I'm working on is a project that's focused on understanding the needs and experiences of families and friends of homicide victims. And this project I'm working in collaboration with Cooper Medical School of Rowan University. My practitioner that I'm working with is Dr. Elizabeth Tercero.
Thank you, Gina. Carol, would you please briefly introduce yourself?
Yes, my name is Carol Berger. I'm Chief Program Officer and Multidisciplinary Team Coordinator at Winona's House. Winona's House is a child advocacy where we work with victims of child abuse and their non-offending caregivers, and we help them navigate through the criminal justice process and through everything else that they are experiencing within their lives. I do prevention outreach within the community. I'm also a retired assistant prosecutor of 26 years with the Maine County Prosecutor's Office, and I was a sex crime prosecutor there, and I also am an adjunct professor at Montclair State University in the Child Advocacy Department.
Great, thank you for that introduction. So my first question is for Sarah. As someone working with sexual assault victims, how do you prioritize victim safety when thinking about the CVR fellowship work with your researcher partner and also in general?
So I'd say generally we're looking at how opportunities to involve survivors in study design, and also where we can provide choice as it relates to participating, so people can choose certainly whether to participate and how to participate when possible. And also always ensuring transparency so that people who do choose to participate know ahead of time what the purpose of the research is for, who information will be shared with, what will be shared, how we're taking steps to protect the identities of those who participate, and also really just being cognizant of how we make it safe for participation, both physically and emotionally for people who participate. Specifically as it relates to, and I don't know how, people probably aren't that familiar with what we're doing, but part of our CVR fellowship project, we've identified 3 potential research projects, and each of those research projects really presents varying issues or a different approach, require a different approach to attending to victim safety. The first one is that part of our office's work is to reach out to individuals who've reported some type of harm or about whom somebody else has reported they may have been harmed. because our office is the place where people who are considered responsible employees at the university, where they must report possible misconduct. And so oftentimes we're reaching out to somebody who didn't contact us first. So the person didn't necessarily initiate the report. And so part of our research idea would be that we would look at how we reach out to people. We have a current standard email template that we use, and we're looking at whether or not we could use motivational interviewing or what we know from health communication research, like how can we revise our current outreach to increase student engagement with our office. And in this particular research study, we're imagining that we could get, that we would be able to get a waiver of consent. And that, because first, we're not expecting that there would be any additional impact beyond what there already is. We're not going to change the substance of the email. We're really going to change how we say what we need to say. And so that one, I think, is probably more straightforward than a lot of other possible research studies. And one of our other ideas is that we would look at how the accommodations we provide to students, how they impact persistence. And in this situation, similarly, we're not meeting with survivors as part of the research study, but we would need to get permission to use FERPA-protected information. And so we're imagining in that situation that our office would get, would say basically what it is and get consent from that individual to hear from a researcher. And then we would not necessarily know whether or not they participate in the study. And so it would not in any way impact their access to services. And the researcher would explain how the information would be used, and they could make an informed, they could provide informed consent or not as to whether or not to participate. The third one I think is the most challenging from a victim safety perspective, and that is that we would want to explore the reasons why individuals choose not to pursue formal administrative complaints. And this would likely involve qualitative or exploratory study using interviews. And in this situation, we would ask students for their permission to share their contact information again. And so we could talk about what would be involved, and they could choose whether or not to participate. And obviously, I think making sure that the people who are doing those interviews are trained on trauma-informed interviewing. And we would want to match student and make sure that the people who are doing the interviews are aged and gender matched to the participants to optimize the level of comfort. We want to involve survivor groups and advocates in how we create the study procedures and how we do our recruitment, and give people choice as to how we use the information that they provide. And I think that's all I have. I'll turn it back to you.
Okay, great. Thank you, Sarah. I appreciate that. Gina, the next question is for you, and that is, as a researcher working with homicide co-victims, what are some of the ways you have made victim protections a priority?
Hi, everyone. So just to give you a background on what type of work we're doing, our data are collected from focus groups with families and friends who are families and friends of a homicide victim. So that's obviously you're dealing with a population where you have to be very concerned about trauma and sensitivity, as well as confidentiality as well. I'm just going to go through some points that we've incorporated into our work to ensure for the protections for participants in our study. Some of these are similar to what was actually spoken about previously. So one thing is to be working with somebody who actually is a family member or a friend of a homicide victim, or an organization that works specifically with this population regarding the language that you're using in your questions, and also what questions are appropriate to ask. Sometimes it's interesting to see what language you use that you don't realize might be language that is not the best language to be using in the field. The other thing is that when we are recruiting for the groups. We do ask people if they would like a reminder phone call or an email in order to be reminded about when the group is going to be held. We specifically ask people if it's okay for us to leave a message at the number that they're giving us or the email address that they're providing to us to make sure that we're giving information in a way that's private to them. It's not uncommon that you might have families and friends that some people are really interested in joining up with a group, a focus group, to be able to share their experience, and others might not within the same family or relationship. So we do want to be respectful of that. For our focus groups themselves, we try to do the best we can in setting up a comfortable setting, making sure that we're meeting in a place that's secure, that there's parking that's available as well. We do have refreshments at our meetings, restrooms, and also to make sure that there's tissues available. And we try to, when possible, hold these during the day, and if that's not possible, earlier in the night. The focus groups that we have, they're usually about 2.5 hours to 3 hours. So we try to be aware of the fact on what time people would be leaving the group. So that's something that we've been aware of. Also, to be aware of nearby hospitals and no locations. There's some groups in the past I've done similar work as well where we've tried to meet close to a hospital as well in case there's any type of emergency that occurs. We do have a mental health counselor at the table, and we do have a plan for an emergency as well in case that's needed. One thing to be aware of is with participant burden as well. It's not uncommon that people will sign up to be a part of a focus group and then decide not to attend the focus group, and that's absolutely understandable given the nature. It could be just a very difficult day or something could have come up that a person no longer wants to come to the group and speak about their experience. So one thing that we have been careful with is that you could have situations where several people are signed up for a group, but one person will show up. So we're aware of participant burden, and we've always asked that person, are you okay sharing your loved one's story with us without anybody else here? And you want to be aware of that rather than sending somebody home without them being able to share their story if they want to. So we do provide that option available for people. We do have an informed information letter to provide to people, also explaining that people are free to leave at any point that they want to. They don't have to answer questions that they don't want to. Giving people space to talk in these groups as well is very important. And I'm glad that Sarah had mentioned this too, but also explaining how you're using the information. I think this is very important to explain to people what you're going to be doing with this. If you're in the position where you're able to talk about what you've done so far, which is what we've done, is to talk to people how we've used this information before and how we're planning on using it in the future, with being cautious too about not over-promising things that you can't deliver. There's always the aspect of doing research, and there could be obstacles, or explaining that it might take a very long time. So explaining to people how you're using this information. For this project specifically, having the ability to translate this into practice is something that we've been sharing with participants in our study. We do de-identify information. The transcripts that we wind up getting, we go through them to de-identify them before we wind up doing the analysis with our team. And also any quotes that you use from people in the groups to be sure in conferences or papers that they are de-identified. When you're dealing with crimes such as homicide crimes, those are crimes that you have to be careful that you're not providing information for anybody to be able to look something up and find out what particular person you're speaking about. We do always provide support resources at our focus groups so that people have this information. And also, I explain to people that we are not allowed to keep their contact information, and that's a part of our study as far as our IRB guidelines go. But I do tell people I'll wind up, deleting your information, but people do know where to find me, and I provide my information if anybody wants to contact me in the future as well. And also that we are people who are just extremely thankful for participants to come and share their stories as well. So that's something that we always emphasize, for people to be willing to come and share their stories about their loved ones is something we're greatly appreciative for. So those are all steps that we've taken in our groups as far as protecting people who are participating in the study.
Thank you, Gina. I have one follow-up for you because time permits, and that is you mentioned ensuring that questions are sensitive in nature, and so I wanted to ask you about how you ensure that the questions you're asking individuals who participate in your groups are trauma-informed or compassionate in nature. What do you do to ensure that?
So one thing that we have done in our projects is to speak to people who either work for organizations or also people who have experienced with families and friends of homicide victims to ask about the wording that's being used as well. And as stated too, whenever we hold these groups, we're always with people who are trained in mental health. We have at least one mental health counselor at the table as well too. And all of the people we've worked with before, they have experience in trauma also.
Great, thank you for that additional information. My last question is for Carol, and that is you've been working with children, as you identified in your introduction, and we know that's an especially vulnerable group of victims. So what types of things have you done when helping your CVR researcher partner collect or examine the information your agency has on child victims?
We're working with cross associates, and the goal of our research project was to assess our multidisciplinary teams and to identify outcome measurement tools. We knew we were doing good work anecdotally, but we had no means of identifying how we were doing work. So we asked them to assist us. And obviously, in order to assist us, they had to have tremendous access to all our data. So the type of things we did to protect our victims in the research was, obviously, we did a background check on our researchers. We had them sign a confidentiality agreement. Once they signed the confidentiality agreement, they were able to attend our MVP meetings, our intake meetings. They met with staff. They met with partners. And they were also allowed to access our database, which is NCA track. But any type of documentation, any white paper, or anything that any notes that they were taking, they were not permitted to attribute to the person revealing the information, whether it was a CPS worker or a family advocate. They were not able to identify, as the previous speaker indicated, anything that would identify that case in the press. So we were making sure, we didn't even use initials, that they were only allowed to discuss very generically what they were assessing. So our research partner, although they have long experience with child abuse and neglect, they really weren't entrenched in a program. So by them, meeting staff and talking to partners, they developed a better understanding of our programs and how we work the dynamics of all these cases. But one of the significant things that we had concern with was we wanted to engage our families to determine how well we're doing. And there is a survey process that we were very reluctant to engage in because of the trauma issues that you previously had mentioned as well. When is a good time to introduce that survey? How do you introduce that survey? What questions do you ask? We are required through our accrediting agency to actually ask those questions. But our staff, our family advocates, were very uncomfortable regarding how to ask those questions. So we've had extensive conversations with our researchers regarding when is a good time to ask those questions and how to present that information in a less than traumatic way. They're usually initially asked questions when they come into our center, and on site we do have mental health practitioners in the building, so we are always prepared in the event that any of the questioning might impact their mental health. The focus of the survey, though, is to find out how we are doing, how are we servicing them, do they feel safe here? So we don't believe that any of the questions will create a problem in terms of a reaction, but you never know. So we've been really engaging in a lot of self-analysis and doing a lot of research regarding how other agencies are handling this information, how do they gather that information. So that's been a really eye-opening experience, because honestly we were kicking and screaming. We did not want to issue these surveys. We did not want to ask these questions until a lot of research was presented to us that it's obviously extremely important for families to feel engaged in this process, for them to be asked, did they feel safe? What could we have done better? What are the outcomes? Have we helped? So that's been very enlightening for me in particular, because I went kicking and screaming regarding, I'm not a researcher, I'm not a data person, but engaging in this process with cross associates has been extremely helpful for me, because I've learned how to utilize data, how to identify data, how to extract information from our data to look at it so that I can, when I am creating programming, that I'm better at creating programming that is going to better assist our clients. So this has been a tremendously successful process for me on a personal level, and I believe for our agency, because it will inform our future programming practices. And we're very, very careful regarding how we share that information, with the understanding that this information is confidential, and we're extremely honestly excited about how this worked out so far.
Great, thank you, Carol, for that information. I'd like to ask you one follow-up related to the survey you were talking about. I was wondering if the survey is being, what's the avenue by which you're delivering that survey? Is it a paper survey, or is it online, or is someone speaking to the individuals directly to ask those questions?
And it's funny, because one of the things that came out of the research project was Cross Associates has a good relationship with our accrediting agency. Initially, we do all three. Originally, the thought process was you were supposed to hand them a survey, and myself and my staff were vehemently opposed to doing that. When people are coming into the center, recognizing for the first time that their child might have been a victim of a severe, serious physical or sexual abuse crime, that's not the time to stick a survey under their nose. We were mailing them. A lot of this is a transitory population, so a lot of times the information was being kicked back to us. A lot of our families live in poverty, so they don't have access to emails. So we were really running into a problem on how to do this. So one of the suggestions that came out of spending a lot of time with our staff and our researchers was to actually, when we are engaging with the family, when they're here at the center anyway, to ask these questions, incorporate them in the course of our conversations with them. And then depending on how that conversation is going, elicit more information, identifying that we are asking for a reason, letting them know that the information they're providing us is to help us better serve clients in the future. But it's really being done on a case-by-case basis, and we're incorporating the questions into our existing protocol, which previously we were told we're not allowed to do, that we had to stick the survey under their nose, which is why we were going kicking and screaming. So this really has informed our process and our practice much better. Does that answer your question?
It does. Thank you for that.
You're welcome.
Well, that concludes the questions that we have for the panelists today. Thank you so much to all the CVR fellows who joined this meeting, and to the panelists for sharing their experiences with all of us. Please visit our Center for Victim Research website at www.victimresearch.org to find more tools and tips on victim protections, including our own tip sheet, which is a quick reference guide on these issues. This concludes our 30-minute panel, and we hope you all have a wonderful day.